Hello, my name is Alex, and I did my project on the effects of co-sleeping, specifically dealing with SIDS, which is Sudden Infant Death Syndrome. So let's get started. First of all, I want to start with the definition of co-sleeping. Co-sleeping is defined as a standard custom of having a child and parent share a bed. However, after researching this topic, I discovered there are two types of co-sleeping: bed sharing and room sharing. The first one is bed sharing, in which we can refer to the definition. This specifically means that the child and parent are sleeping together in the same bed. According to Belsky in Experiencing the Lifespan, behaviorists warned that this type of co-sleeping would produce excessive dependency from the infant upon the mother. Now, the other type of co-sleeping is room sharing, which is pretty self-explanatory, but it just means that the parent and the child share a room when they sleep. However, the child is either in a bassinet or a crib next to the bed. The child is not directly in the bed with the mother. 50% of mothers co-sleep with infants, and the type of co-sleep that they practice more frequently is bed sharing. While recent cultural implements such as cribs and mattresses didn't evolve to protect and feed infants, protective maternal behaviors did, including bodily contact, especially during co-sleeping. There are a number of reasons why mothers co-sleep with their infants. For example, it's easier and it's a faster way to cater to the crying infant rather than to get up and walk to a separate room. Also, it's just that bodily contact that mothers like. It creates a bond, and also their protective instincts that makes them want to co-sleep with them. One of the most popular reasons, however, for co-sleeping is breastfeeding. Studies have shown that breastfeeding mothers are 3 times more likely to co-sleep, which leads to the benefit of increased contact, increased proximity, convenience, less infant crying, more maternal and infant sleep, and the mother has an increased milk supply. Co-sleeping, however, is a controversial subject. It has brought up issues about SIDS, which stands for Sudden Infant Death Syndrome. Sudden infant death syndrome is the sudden death of a seemingly healthy baby in its sleep. This is such a tragic event because it's one that cannot be solved. You can perform investigations or autopsies, but in the end, it just seems to be unexplained. Sudden infant death syndrome is the most common in infants from 1 to 4 months. It is the leading cause of infant deaths and accounts for more than 4,000 deaths in babies per year, and that's just in the United States. It has, however, seemed to decline in recent years due to the recognition of national campaigns, such as the Back to Sleep campaign, which doctors recommend that parents put their infants to sleep on their back. But we will get into this discussion later in the presentation. Some risk factors of SIDS includes the prone sleeping position, which means putting a baby to sleep on his or her stomach. Another risk factor that it would include would be co-sleeping, because with parents, siblings, or pets, it could cause an infant to be smothered or suffocate or something like that. Other factors include side sleeping, unsafe bedding such as loose sheets, blankets, pillows even. There's also exposure to tobacco smoke, parental drug use, parental expired air, which means that the air that we breathe out, the infant would immediately breathe in. Also, a low birth rate and infection. Some parents are against co-sleeping due to the risks. However, according to Russell Alexander, there is no association between co-sleeping and sudden infant death syndrome. A couple of studies have been performed to see if there is a connection between co-sleeping and SIDS. There was one study that was performed by Patricia Schnitzer, in which she obtained her information from the National Child Death Review case reporting system. The NCDR-CRS serves as a web-based system for the collection, analysis, and reporting of the CDR program data. She asked questions that were relevant to the infant's death and the people or objects in the infant sleep environment relevant to this position. Out of the 3,136 sudden infant deaths available for analysis, the majority occurred among male infants, which was about 57%, and 71% of them were younger than 4 months. 24% of the infants were found in their crib or bassinet, but most of them were found within an adult bed. 13% were on a couch or chair, and 16% were unknown. 25% of infants were on their back, as well as 35% were on their stomach. Position was owned in 26%, and 14% was missing. Patricia believed that her findings were consistent with other studies. She believed that they were largely consistent with those studies that have described the sleep environment and other characteristics of sudden infant death syndrome documented in CDR or medical examiner data. Her findings were also consistent with well-documented SIDS risk factors. It is also important to note that most studies identifying sleep risk factors for SIDS were conducted before the diagnostic shift in classifying sudden unexpected infant deaths as suffocation and undetermined cause. The deaths classified resulting from suffocation or undetermined causes were more likely to be found in adult beds, couches, or other surfaces not intended for infant sleep and sharing the surface with an adult. Mitchell-Lancet also did research, and although 7 studies showed co-sleeping increases the risk of SIDS, it does not show a positive relationship between co-sleeping causing SIDS. He also mentions prone sleeping to be dangerous because of infant development. It is possible that the lack of certain gross motor skills in younger infants may increase the risk of SIDS while co-sleeping. At that stage of development, infants are unable to lift their head or roll over at that stage of life, which can lead to suffocation if put to bed on their stomach. That means when they wake up, they may not be able to have the strength to lift their head or roll over. That way their face would, they would suffocate because their face would be into the mattress. Also, bed sharing encourages breastfeeding, although infants feed 3 times longer. A campaign launched in 1994 called the Back to Sleep campaign encourages parents to place their infants on their back when putting them to sleep. It's recommended by the American Academy of Pediatrics. It also promotes room sharing because although parents are not in the same bed as the baby, they are in the same room, which enables them to check on them and be close to them without risking SIDS by suffocation or smothering. And as a result, it has decreased about 50% of infant-prone sleeping. Also, it has reduced in SIDS by more than 40%. We can also attribute this reduction to doctors who, in the hospitals, recommend new parents to put babies to sleep on their back when putting them to bed. So, is co-sleeping okay? Well, according to McKenna, it just depends. No way is right for every family. Defined in this way, there is a fairly general agreement that co-sleeping is the safest arrangement for a baby. But there are 2 types of co-sleeping, and room sharing is favored over bed sharing, just because it reduces the risk of smothering or suffocation. Crib sleeping in a separate room may double the risk of sudden infant death syndrome because you wouldn't be able to hear the baby if they were struggling or suffering for air. McKenna also presents evidence that co-sleeping promotes more stable vital signs, more and better sleep for both mother and baby, and even more effective breastfeeding. However, he does agree that no way is right for every family. The American Academy of Pediatrics does not recommend co-sleeping. However, the UNICEF WHO baby-friendly hospital does endorse it. So, whether you bed share or you room share, it just depends, and that's what McKenna argues. Well, thank you for listening to my presentation. Here are all my sources that I used. I hope you enjoyed it, and have a good night.